Thank you so much for making time to spend the next hour with me. It is very much appreciated. Today, we begin in Nigeria, where the coronavirus has claimed the lives of 2 doctors. The latest one losing the fight on Wednesday. We are going to bring you details. I'm going to be speaking to the president of Nigeria's Medical Association about this loss and about the fight against COVID-19 itself. Also, locusts are tearing through East Africa. What do you get when you put locusts next to a pandemic? Well, we're going to get answers from someone from the Food and Agriculture Organization. Cyril Ferrand will be with us to explain how bad the situation is there right now. And also, in the midst of this crisis, in the midst of disaster, everyday heroes are emerging. I'll bring you a brand new story about someone who is making a difference on the ground in Africa right now. All of that and so much more just ahead. Let's dig in. Well, the world is facing a relentless, invisible enemy, which to date has not been defeated. With every passing hour, the number of confirmed coronavirus cases go up, and with that, this wave of destruction, of despair, of death, that wave widens. In Africa's most populous nation, of course, I'm talking about Nigeria, they are battling the virus as well. The president there, speaking in a televised address earlier this week, described the fight as essentially a matter of life and death. And we know that it is claiming the lives of health workers. On Saturday, Dr. Aliyu Yakubu died from the virus, from COVID-19 in northern Nigeria. And then on Wednesday, it emerged that another doctor had died, Dr. Emeka Chugbo. The death has sent shockwaves through the country, through the medical community. Let's go right now to Lagos, Nigeria, where we can speak to the president of Nigeria's Medical Association, Dr. Francis Adebayo Faduyile. Dr. Faduyile, thank you so much for joining me.
Thank you very much. It's my pleasure to be here with you.
Let me first start by asking you to share with us what you know about what happened to Dr. Chugbo.
Well, thank you very much. Dr. Chugbo is a gynecologist who have a private facility, and he has a case of a COVID-19 patient that came to his facility. And while he attempted before the diagnosis to treat that patient, he subsequently contracted the viral illness from the patient. About 3 or 4 days later, the patient was taken to the isolation center where he died. And Dr. Chugbo started showing signs of the COVID-19 infection. He has to finally get to one of the isolation center, which is the Lagos University Teaching Hospital, where he subsequently died the day after that. And it is a very shocking death. It goes to show that all our private facilities, as well as any of the hospitals, are likely to have patients who may have this COVID-19 illness presenting to the different doctors. And many of the time, you don't have the full complement of the PPEs to be able to see patients generally.
So let me jump in there and ask you about that matter of the PPEs. Talk to me about the availability of the items. I mean, when we say PPEs, we're talking about personal protective equipment. We're talking about masks, gowns, and we're talking about gloves. What do you have? How much of it do you have there in Nigeria?
Well, we must know the situation in Nigeria. We don't have any company that is producing any of these different type of PPEs, gloves, masks, the goggle, the apron, and the face mask, especially the N95 face mask. So we depend solely on those that are imported to this country. And as you are aware, the pandemic has really made it difficult to get from the countries where many of them are being produced, because those countries by itself are in short supply of the PPE. So we have to scout around to see people who can support and donate to Nigeria. Presently, the few PPEs that are available are majorly at the isolation centers, and we have some one or two that are distributed to the different hospitals. Those are the normal hospitals that are not the isolation hospitals. And that is where the weakest link is, because many of the patients who are positive usually present at those different hospitals where they may subsequently be tested and confirmed. And if we don't have enough PPE at those areas, you expose the health workers at those facilities to unnecessary risk of contracting the COVID-19 virus.
So I want to be very clear with our viewers. Are you saying, Dr. Faduyile, that there is a likelihood, or certainly that you fear that there are places in Nigeria where healthcare workers are directly interacting with COVID-19 patients if they're infected, even though they may not be hospitalized, but people who are carrying the virus and they don't have PPE protection?
Well, I can paint a scenario: a patient who had a road traffic accident and is rushed down to the emergency unit in the hospital, maybe for fracture and others. If you want to look at it based on the trauma, you just want to go ahead and treat, and you may just find out that that patient is having a COVID-19 infection. So if you have not put on the necessary gear, one can contract it from that patient. So what we are saying, we have had some occasion where a patient who was having a very highly contagious illness came in labor, and the doctors who went to do the surgery, the operation, the CS, contracted the disease. That is Lassa fever in this country. So what we are saying is that in our regular hospitals where you see regular patients, sometimes it is important that we have PPEs everywhere, so that any patient is a potential COVID-19 positive patient, because there's no way you can know a patient is COVID-19 positive until you do a test. Okay.
And so let's talk about testing. You've also been very vocal. The association has spoken up about the rate of testing. How satisfied are you with the situation? Let's start with there in Lagos. There has been some increase in testing. How satisfied are you with where things stand today?
Well, as it is, I'm happy that the NCDC has come out that they can do up to 5,000 tests per day, which is a good and a great improvement from what we had on ground. Unfortunately, this test that we are talking has a lot of logistic issues, because it is not a fast mass testing kit that you have. For you to be tested, you will still need some of the members of the team of NCDC to visit you at home to take your sample, take it to the hospital, take it to the laboratory, wait for some hours before the result comes out. And this waiting hour and also quote unquote stigmatization has made a lot of people who ought to come out to get tested staying back, and they don't want to just be stigmatized. So we want to believe that it would be nice for us to have two stages of testing. The first one, which is massive testing kits, where we can have positive, negative, and those who are positive will go for confirmation, so that we do not block the rate of getting the results, and we can use it immediately to triage the patients. Those who are positive can quickly go to the isolation area and get confirmation, and those who are negative, we know that they are negative and they can be treated. So these are the way that the Nigerian Medical Association is looking at it at present, although the NCDC still believe that it is only the PCR test as recommended by the WHO that should still be used in the country.
So you mentioned stigmatization there. How big an obstacle is that to getting a handle on the situation? And that certainly, the fact that that is an issue points to possibly a communication problem in the way the narrative about this disease is being shared. Talk to me about what it is that people are fearing specifically that is stopping them from going to get a test, or certainly acknowledge the fact that they're feeling unwell.
Well, as it is now, we have some quote unquote big men who feels that they do not want to go to the isolation center because it may be lower than the standard that they want to live. Okay, and we have a lot of them in the initial part before we started having the second stage of the community transmission. Those who had travel history have, many of them have denied or refused to inform the physician that is seeing them about that history. And this has caused a lot of unnecessary risk on the health workers who have seen them. So that is number one. They have started giving false information during the time that they are seeing their physician. And after that, we have had a lot of people who are staying back at home and they are sick. Some of them are sick, but they don't want to come out. We are also trying to see how we can do more of education to let them know that COVID-19 infection does not mean death sentence. That we have a very high level probability of surviving it. But we have a lot of misinformation in the air that a lot of people felt that they rather keep to themselves, their status, than to expose themselves and be taken to isolation wards or the treatment centers.
So, Dr. Faduyile, I'm running out of time, but I've got to ask you something before I let you go. The Chinese doctors, you know, as you paint the picture of struggling for PPEs and to get testing done, and from what the picture you're painting, really being able to, while testing has increased, clearly there's more to be done to get a handle on the situation. It was widely reported that an invitation was extended to some Chinese doctors. There's been some confusion and back and forth. Was it extended? Were they coming to be part of the response? Were they coming as private guests? Can you clear up the situation? Because what we do know is that the Nigerian Medical Association came up very strongly against the involvement of a contingent of Chinese doctors being involved there on the ground. Can you clear up the situation for us?
Well, about the Chinese quote and unquote medical experts, which they have been called, we have a lot of conflicting information about their motive for coming to our country, Nigeria. The first thing we want to appreciate is the CCECC, that is the Chinese company, construction company, that in their own wisdom have decided to support Nigeria with medical consumables, ventilators, and other PPEs. We appreciate that. And we want to say that right before then, Jack Ma, a philanthropist from China, has given 54 African countries some equipments and consumables, which we also appreciate. However, when the CCECC is bringing its own medical consumables, he also added that he has to bring in some quote and unquote medical experts. And the first question we asked from the federal government is that of what use are this group of people coming to do? They told us that they are going to share experience with doctors in Nigeria. And on a second thought, we said we can share experience via Skype, as we are doing now, or other telecommunication or telemedicine or teleconferencing or Zoom meeting. We can get all that we needed if it is for experience. But they said they are coming also. Later they said they are coming to come and that their technicians to come and install some of the equipment that they are bringing. But they are just bringing 50 ventilators. We have doctors who can operate ventilators. Even if you have to train us on how to operate the ventilator appropriately, we can also do it via the Skype and other teleconferencing. So we told them we do not see reason why they have to come. Mm-hmm. But the government,
Dr. Faduyile, are you still with me? I think we may have lost him.
Hello?
Are you there? I hear you.
Yes, I'm here.
So just to be clear, you'd made the point that you were willing to accept any technical assistance, using technology, using Skype or Zoom or whatever platform, that they didn't need to come into the country. So to be clear, is the Nigerian Medical Association against any foreign doctors coming into the country, or is it specifically about the Chinese? I just want to be clear on that.
It's not about the Chinese, it's about any foreign country. Nigeria is a sovereign country. For you to come to Nigeria, you need to pass through the normal regulation, get your certification, we know what you want to do, then you can now practice. But it is wrong for you to just come in, and when the MD of CCECC came out, he told us that they want to start treating their national, and this is against the ethics of the profession, it's against the sovereignty of Nigeria. And we say, no, you can't do that. It is against every known regulation in terms of our profession. So it's not particular about Chinese doctor. It is keeping the profession of medicine and the sovereignty. And importantly, we want to say that Nigerian health professionals are doing well in treating those who are sick in Nigeria. Mm-hmm. We have discharged a couple of hundred of, over 100 of them that have had this COVID-19. And again, the World Health Organization had at a time commended Nigeria for the great job we have done. So I think it is on that basis that we said, look, there is nothing additional they are likely going to give us. So if they have any information, we can do it via Skype or via other teleconferencing.
And I know I'm out of time, and my producer is going to kill me. How afraid are you, as the medical community there in Nigeria right now, given the deaths of two of your own?
Well, it's unfortunate that we have lost two doctors, but we know sometimes it can occur like that. We have made a lot of presentations to the federal government that those who are at the periphery hospitals are those who may be more likely to contract the illness, because if we are ill prepared for them to see patients who are possibly positive, then that is the weakest link. We are hoping that they can strengthen the PPE, and doctors generally should observe more international best practices.
All right. Dr. Francis Adebayo Faduyile, thank you so much for your time. And again, our heart goes out to, the families touched by this tragedy, and the fact that you lost your own at a time when every healthcare worker is so critically needed, as they always are, on the continent. So we appreciate you making the time to speak to us here. Thank you.
Thank you very much. It's my pleasure being here.
Thank you. Be safe. So, just to drive home the risks, as if they needed any further reinforcement, Nigeria losing two doctors dying from COVID-19. The first one dying on Saturday in northern Nigeria, Dr. Aliyu Yakubu, and then the word emerged on Wednesday of the passing of Dr. Emeka Chugbo in Lagos. You heard the president there of Nigeria's Medical Association. They need more PPEs, they need more testing. It needs to be scaled up, and there are hospitals where they just don't have enough PPE, and those working on the front lines are at risk. We'll continue to follow the situation for you there in Nigeria, and of course across the continent. And here on the show, we make a point to pause to remember and honor those touched by this tragedy. So many have lost their lives. Over 180,000 people around the world have died. And we try every day to bring you the story of those from the continent who have lost the battle against COVID-19. I want to tell you about a nurse, a young woman who lost the battle in the UK. This is a heart-wrenching story, not just because she is young, she was 28, but also because she was pregnant. I want to tell you about Mary Agiwa Agiapong. She was a nurse at the Luton Hospital in the UK, where colleagues described her as a fabulous nurse and a great example of what we stand for. She tested positive for COVID-19 earlier this month. According to an internal email that was sent around to the staff after her passing, the doctors say that as her condition worsened, they made the decision to perform an emergency cesarean. And they say initially Mary showed signs of improving, but sadly she passed away on Sunday. And her baby, I know we're all thinking about the child. Well, the little girl, she survived and is being described as a beacon of light in this dark time. At this point, we don't know if the child also has the virus. But we do know that we are sending thoughts and prayers to Mary's family. We are carrying the little one in our prayers, and our hearts go out to all her loved ones. So much grief, so much tragedy. As this situation goes on, we're keeping one eye on the coronavirus pandemic, of course, but there are also a host of other things that are also happening simultaneously. The other trials, the other tribulations of life continue. So I'm talking about East Africa specifically, where they're battling coronavirus and they're also battling locusts. Yes, you heard me right. According to the UN, a second wave of desert locusts are filling the skies. Millions of these insects are filling the skies with black clouds, and they are devouring everything in sight. If you've ever wondered how much destruction locusts can do, well, let me tell you this. A swarm of them, a little more than a third of a square mile, can eat in one day, just one day, the same amount of food as 35,000 people. So a swarm of locusts, less than a third of a mile, can eat the equivalent of food consumed by 35,000 people in one day. This is what East Africa is battling right now. Earlier, I spoke to Cyril Ferrand from the UN's Food and Agriculture Organization and just asked them, quite simply, how bad is this? Cyril Ferrand joins me now from Nairobi. Cyril, thank you so much for being with us. Let's start by getting a situational update. How bad is the situation currently with these locusts?
Well, it is bad. It was already bad in January or December, January, but now we are facing a second generation of desert locusts, and the second generation is 20 times bigger than the first generation because it reproduced and goes exponential. Every 3 months, the desert locust can multiply by 20, which means 20 times bigger after 3 months and 400 times bigger after 6 months. So indeed, the battle that we are engaged in is complex. And we are addressing the needs of people in a region where already before desert locusts started to appear, we had already 20 million people in Eastern Africa region that were severely food insecure. So indeed, the desert locust situation is an exacerbating factor to the vulnerability that does exist in this region.
Wow. So when you put these desert locusts and a coronavirus pandemic together, what do you get?
Again, this is a coronavirus. COVID-19 will be or is an additional layer. At the moment, in this part of Africa, the number of positive or tested positive people is still relatively low. In Kenya, for example, the first case was reported on the 13th of March. and a month later we have around 210 cases for about 8 fatalities. So nothing compared, obviously, to the magnitude of problem in North America, but indeed the number has increased. And if the situation was to further deteriorate regarding the pandemic, obviously that could be almost a perfect storm of fragility in the region, plus desert locust and COVID-19.
So while the cases are relatively low, comparatively low, and thankfully the deaths also, there are the restrictions on movement in place. There's a curfew in place in a place like Kenya, where you're speaking to us from. Talk to me about how the border closures, the restriction on air travel, just what that means for being able to effectively fight these desert locusts.
Well, indeed. I mean, it means that for us, with the closure of international airports and the closure of international borders as well, of course, it's a challenge for us. It's a challenge because we are still receiving experts, and these experts can no longer come, but a number were already in the region, which was quite positive and in our favor. And if we were, and the latest one that we had to bring in Kenya, for example, had to be quarantined for 2 weeks. So they were in country but could not operate or support the desert locust operation. Then we have an issue potentially also of the supply of assets, spraying equipment, pesticides. We have delays, but the Food and Agriculture Organization has been anticipating a little bit that situation, in the sense that we didn't place all the order with one supplier from one part of the world, but we have supplies arriving from all over the world, from Europe, from North America, from Asia, which means that we have spread a little bit the risk somehow, and we have purchased all our items in batches, meaning that there are some batches that are delayed, but some of the other batches have arrived already. So we are able, with that kind of contingency plan, we are able to still run the operation at the moment with sufficient supply and equipment. Within the countries, Kenya and Ethiopia in particular, desert locust is elevated at the level of national priority, which means that there is no restriction of domestic movement within the countries. The people who are engaged in the fight against locusts can still operate, which is very, very positive.
Mm-hmm. As you look at the situation in the region, and as you talk about the exponential growth of the swarm, what is your worst fear?
I mean, for us, when we are looking at the trajectory and where we're looking at the scenario, I mean, we are building our analysis on 3 scenarios. One, which is the most favorable one, which means potentially favorable climatic condition for farmers to have a good season and for pastoral communities to have a good grazing area, combined with a successful locust control operation. If we have a good rainy season and a good control operation, then the impact will be somehow, I wouldn't say marginal, but at least minimized. Then we could have a midterm scenario, midway scenario, that is less successful control operation and slightly less favorable climatic conditions. And then in that scenario, we could have 2 to 2.5 million additional 2 to 2.5 million that are falling into extreme fragility from a food security point of view. And the worst case scenario, which is no control possible because the magnitude is far too big, and unfavorable climatic conditions for farmers. And in this situation, we could have up to 5 million people in addition to the already 20 million who are food insecure. So yes, indeed, these are the kind of scenario that we are working on. And the control window, the window for controlling desert locusts, started in February and it's open until June. By June, in theory, the weather conditions should become less favorable for breeding for the desert locusts, meaning that that should be the end of the rainy season. The situation should be slightly different, and then desert locusts should be moving potentially partially away from the region. They will be in Sudan, and then also from Somalia. They could be crossing towards Yemen or even towards Asia. where we also have outbreaks in Iran and Pakistan and in India as well, and in the Arabic Peninsula. So the problem should not be solved, I would say, globally. It would be partially solved locally and then transferred to other parts of the world if the winds are blowing in the direction towards Asia.
Well, it's frightening indeed. So, Ferrand, we're wishing you the very best. As you say, this is an essential fight, and thankfully, people in the countries involved have been given the freedom to move. We just, we hope that the situation could be contained quickly. So, Ferrand, joining us there from Nairobi, appreciate you. Thank you so much.
Thank you.
As he described these locusts, he said that the young ones that can't fly yet, the young ones are called hoppers, and they're just on the ground. And he said when you see them out there, it's like a moving carpet, millions of them just covering the earth and writhing and moving. And it just doesn't even bear thinking about a situation that must be brought under control, because, it really illuminates the concerns around food security. And at a time like this with COVID, just really nowhere in the world needs more problems. Again, as we talk about coronavirus, it is undoubtedly, when we talk in Africa, potentially a huge catastrophic health crisis. It is also a slow-moving economic tragedy in the making. And this is what African leaders are grappling with. According to multiple reports, sub-Saharan Africa could fall into its first recession in 25 years. And as such, we've seen African leaders from across the continent basically call for a massive stimulus package of about 100 billion, half of which would be, or at least a significant portion of that would be made up by a suspension of debt repayment. That is what they've been calling for as part of this effort to boost their fight against coronavirus. There has been some movement on this front. Let's bring in our own Zain Verjee, friend of the show and Kenyan. So I know she was watching that interview about the locusts pretty closely. Could you hear it? At one point.
I could. It's a very devastating scenario, and the timing couldn't actually be worse, as you well know. And the kind of graphic way in which the locusts and the hopper scenario was described is actually, it's tragic. And so you're grappling with things on multiple fronts, the health crisis, hunger crisis, travel bans and closures, and challenges of bringing in food. So it's sort of like a sort of three-pronged tsunami there that's happening. So I hope it can be mitigated in some way, and money is one.
Money is one. So let's talk money. Our leaders on the continent have been vocal about the need for assistance. They talked about, an economic stimulus package to boost the effort of fighting coronavirus. Part of that, they said, could take the form of the suspension of debt repayments. Where are we with that? Because I know there've been a series of meetings in the last couple of days.
Now, Aisha, I'm not a mathematician or an economist, right?
Well, you're certainly looking in the wrong direction.
So that having been said, this is what I'm able to surmise in a way that I get, right? So the finance ministers of the continent have all gotten together. The heads of state have all gotten together, and they've said, listen, we need some fiscal space. We need some financial relief, right? So what they're asking for is a debt standstill, not forgiveness, but a standstill, not a cancellation, but a pause of $100 billion. So from what I understand from sources involved in the negotiations, that, they're not quite there yet. There's still some distance, but they are having talks with IMF, World Bank, the ECB, to try and figure all this out, And what they're essentially looking for is a standstill on $44 billion. That is debt and interest, right, for all countries. on the continent for now, right? And then they are looking for an additional 66 billion to kind of boost health systems, deal with the hunger crisis, etc. So whether that's more than likely in the form of additional loans. What I want you to think about, Aisha, is like, you know how you make a mortgage payment, right? So essentially what's happening here is that anyone who has to think of that scenario, you get paid. Money comes into your account. You know that you have a mortgage payment to make. And so say for the next 5-6 months, you decide whatever my mortgage payment is, say it's $3,000, you put it aside because you know you want to be able to make that payment and therefore have shelter, right? Mm-hmm. So you keep the money in the bank, right? So if the bank comes and says, you know what, Aisha, there's coronavirus, it's a crisis, so we're just going to give you a break and you do not have to pay your mortgage for 6 months. What happens there is that you've been holding the cash. So instantly you have real money available to deal with, go buy more food, go buy more this, do that. So that's exactly what the African countries are asking for. They're saying, we have put aside money to pay our debt and our interest payments on the principal, but if you can just stand still for now, that will immediately free up $44 billion, wow, and we can deal with some problems. So that's what's happening.
So tell me what's holding this up. I mean, you know, there's been some meeting, there's some movement, there's been some consensus from certain regions. What's going on here? What's the back and forth? Because I mean, it's quite clear that the world is in chaos. People need to fight the scourge, and they're going to need the money to do it.
So a lot of these countries are now dealing with their own problems. It's not just Africa or Asia or Latin America going, help us. So first of all, they have their own financial issues, right, in those countries. So that's one. Then you have multiple entities. You have private sector debt, right, that makes up this amount of money. You have multilateral debt. You have bilateral debt, where China is the biggest lender here. So they're holding like $8 billion in debt on the continent, right? And so you have to have movement and agreement on all fronts to make a figure of $100 billion. And so the African Union has a task force of, I think it's like 4 people that are going around pressuring. The finance ministers are trying to deal with their individual windows at the World Bank, but they're also coming together with their multilateral debt as a group going, stand still here, allocate new money here, repurpose old money here, and so make up this figure of $100 billion. The actual debt that Africa has, the external debt, is something like $412 billion. Right, so we're asking for a standstill of 100 billion, which might not be enough, and there'll be 50 billion perhaps asked additionally from this. So, what you're alluding to, I think, is the progress that was made also at the IMF, where the IMF said between now and December
it would suspend.
But the thing about that, and this is what the conversation is on the continent, the thing about that is you can pause the debt repayments from poorest countries. So what happens to the countries on the continent that are not defined as the poorest countries? They're not the Central African Republic or Niger or whatever, but they're bigger economies. Yeah, and that debt's not forgiven. So there's no fiscal space there. And while poorer countries could then potentially deal with the coronavirus crisis and the health systems, if I go backpacking then over to Central African Republic or Mali or wherever, and I have coronavirus, I can basically cause spread. So there's no point having, this sort of, we'll forgive you, you're poor, because, this is an interdependent scenario. And so what African countries and ministers are saying is that you can't forgive a handful over here.
You have to do everyone.
You've got to do it for everyone. And, China, just briefly, I told you, has like 8 billion in debt. Are our creditors, right? And so China's like, we want to just deal one-on-one with every country in Africa.
How long is that going to take?
We deal with you. Yeah, you see, now that's the thing. It's going to take a long time. We don't have time. And number 2, you don't want to have, we'll make a deal with Kenya here, and we'll do this with Rwanda there, and we'll do this over here, with whoever, South Africa here, or Ethiopia. So the African Union and African leaders are saying, no, China, you deal with all of us as one block. You make the same agreement for all of us, and khalas, let's move forward. right? So we haven't heard back from China, from what I understand. So, the head of the African Union Council, Cyril Ramaphosa, sent a letter saying, on behalf of the African Union, let's just make one deal. So that's the holdups. And the decision on this 100 billion is happening this weekend at the spring meeting. So it's, we're like 72 hours-ish out.
Okay, so market diary will get you back. I don't know what you were planning on doing, but nobody cares. Like, the continent needs you. You may not be a mathematician or an economist, but we still need you here on Home with Isha Sesay to break it down. I mean, break it down accurate, to kind of go through it.
But I don't want to like watch the spring meetings on weekends. I want to watch Netflix. I want to watch, this new show I've been recommended. But I guess I should watch the spring meeting.
You've got a full 24 hours. That's a good thing. You're not going anywhere. You're in lockdown in LA. So you can make a little time to squeeze in the meetings, make some notes, and share them with us at the top of the week.
All right. I'll do that. I'll do that for you, anything.
Thank you. Be safe, my friend.
All right.
Take care. Thank you. All right. So, there you have it. There's been the debt for the poorest countries suspended till the end of the year. But, what we need on the continent right now is consensus. We need the entire continent to be supported, because coronavirus doesn't know borders. So everybody's affected. So that means when a deal is made to protect economies, to boost the fight against coronavirus, everybody needs to be covered by that deal. And so right now we wait to see whether that will be extended to everyone. We wait to see what China will do. You heard Zain say very clearly, China wants to do these one-on-one deals with everyone. Nobody has time for that. Not right now. We're in a pandemic. We're in a crisis. We need quick, decisive action that will support the continent right now in its fight to halt the transmission of this virus. You have been writing it. Thank you. I want to thank you so much for being part of the conversation. Let me get to some of those comments. We would have done it earlier, but as you can tell, it's been a busy show. So let me just get to some of what you've said. I could see there's a lot of activity as I spoke to the president of Nigeria's Medical Association, and I want to thank you for that. Isaac Gabrayan and said, Africa and its leaders, our doctors' lives are in danger. That is very, very true. Every doctor on the continent, every doctor involved in this fight around the globe is in danger, and they need the PPE as part of that fight to protect themselves. Alhaji Ekroma says, Africa countries are finding it difficult to make provision of PPE, instead of waiting for intervention of the Western world. I think some of it is, it's difficult to get hold of. That's also part of the problem, that everyone in the world is scrambling for PPE right now. So it just makes this a very, very difficult situation. People saying very kind things. People concerned about the situation with the locusts. Ibrahim Lansana said, what has FOA done to combat the spread of the desert locust? They're working with partners, and they have experts in the region, and they're working to mitigate their spread, to spray them. And it's a very complicated situation, as they explained to me earlier, but they are trying to get the situation under control. Someone, Colin, said, locusts, actually, I've seen people eat them, and even a major business for women here in Maiduguri. Yes, I'm aware that locusts are eaten in some parts of the world. That's not the goal here, though. There are millions of them. The goal is to get rid of them before they eat everything else. So I take your point, but the goal is to get rid of them, not to worry about eating them. Kari Mansaray, Africa will be severely hit. We are concerned about that indeed. Teddy Sako, wow, then the interest on that 44 billion should be cancelled. Otherwise, these countries are never going to come out of debt. This now in reference to the conversation I just had with Zain about this debt and the need to have payments suspended. Thank you for writing in. I try to cover the span of the whole show and bring comments from every segment we've done so far. Just this very quickly, Harris Kange said, thankfully, COVID-19 not as ravaging as a swarm of locusts. Yeah, I mean, I mean, not immediately, but nobody wants to be dealing with COVID-19 or locusts. Thank you so much for the comments. Keep them coming. You're a vital part of this conversation. And as always, I try to get to as many of them as I can throughout the show. So thank you. Thank you for writing in. All right, moving on. We know that with disaster comes destruction and chaos. That's a fact. We also know that in these moments, more often than not, we see the best of humanity. We see everyday heroes step up, step into the gap that opens up and care for the most vulnerable and the needy in their communities. You've already heard of countless stories like that, and we like to share the ones we come across here on Home with Isha Sesay. And today we want to share another one with you, this time from Kenya. Recently, a young doctor tweeted this, and it said, "Any lady in this curfew and COVID time who feels they're unable to reach hospital and they are in labor or have an emergency, kindly reach out and I'll do my best to intervene." That tweet was sent by Jemimah Kariuki. She joins me now from Kenya's capital, Nairobi. Jemimah, welcome.
Thank you.
Thank you for joining me. I can hear you. Thank you so much for being with me, for being with the viewers. Talk to me about what led you to putting out that tweet.
First, thank you so much for everything. I think we got a tweet from one of the doctors in one of the areas, in one of the sub-county areas of Kitui, which is in the rural community, where he was saying how he's seen 3 very, very poor cases, very poor outcomes in hospitals based on this COVID curfew. Our country has instituted a curfew from 7 till 5 a.m., which means that in that period, there's no public transport, there's no cab transport, there's nothing other than the essential workers, which include doctors, include healthcare workers, include police service and the likes. So when that tweet came out, I was quite sad because, okay, that was quite sad. So I reached out to him and I asked him exactly what's going on. And he told me how we have patients coming in with bleeding continuously, bleeding a whole night, patients who come with retained placenta, patients who are coming in almost dead. Soon after, there was another publication in the news that one woman had actually bled to death after delivering her baby. So the baby luckily survived, but the mom had bled out. And in this day and age, honestly, that's not one of the things you want to hear as a doctor, as a mother, as anyone. You don't want to hear that someone is dying in childbirth. So I have special interest in obstetrics and gynecology. I'm actually doing my residency in obstetrics and gynecology. So basically, I was like, we need to do something as an obstetric community. And at the time, everyone was like, the government should do something about it. And I was like, but they're dying daily. So what do we do now? So I just tweeted. I actually just tweeted. In the beginning, I had no clear picture of what I would do. Back on my mind, I thought I'd just drive and go and I don't know, deliver or take them to hospital or something. Like I would just do whatever it is that I would be able to do based on where they were. So yeah, that's what led to the tweet.
What happened? You put out the tweet, and what was the response?
It was something beyond me. Like I did not anticipate the kind of. I'm on Isha Sesay. Like it was.
I mean the serious response. Don't count me. I'm talking about the real work you're doing. Tell me what. I mean, I'm stunned.
So basically, by the next day, I had gotten so many calls from very many women, most of them expectant, almost due. So 36 weeks, 37 weeks, almost going to 40 weeks. They had not gone for clinic since we had the whole COVID thing. So many were just scared. What happens? What do I do? So it became a journey of guiding the women. These are the danger signs. This is what happens. And I would get calls as late as 5 a.m., 4 a.m., text all through the day. So I'm kind of doing night shift every day. But basically, many women just let me know that I really did not know what to do. At least now I can do something, or I know who to reach. And then after a few days, because that reach has been up a week. So the last 3 days, I'm actually being called by women in labor. Wow. So the first day I was called, So the first day I was called by woman
when they're actually in labor.
Basically triage and find out exactly how far along are you. So the first day was funny because I called the emergency service cares, the ambulances. I really did not know how costly they were.
But what did they say?
I called them, and I had to do a lot of linking between the emergency care and the hospital. And luckily, we were able to get people to get the patient to the hospital. But that showed me that we have an issue with facilitating the transport. Yes. So after that, I was able to reach to my consultants, my seniors, and to try and see what can we do. So from then, it's been meeting after meeting of trying to find a way around it, and how can we get transport to these particular facilities, geomapping of our hospitals, because some of those things don't come to light until someone is actually working on ground. And today, right now, actually, a patient who called me yesterday, in hospital, from their homes, I was able to get an emergency cab for them, and they were here. So I've actually just reviewed her, and she's okay. The baby is fine, no complications. It's just a blessing to me.
It's an enormous blessing. How does it make you feel knowing that in this moment, and when people were just saying, "Oh, it's the government's job," and nobody can do this. It's like, and you said no. We can come up with a plan, and you're now actually putting that plan into practice. You're helping people. How does it make you feel?
More often than not, overwhelmed, because I really did not anticipate such a huge burden. But after that, I feel blessed. I feel so blessed, because it's not every day that you feel like God's using you directly to impact so many people, and to bring in so many different stakeholders. And it's amazing watching even my teachers come in and come up with such amazing ideas. And every day you're like, okay, this is a step further. This is a step further. Hopefully by the end of this, we'll have a system running that we have doctors on call, and people who can, ambulances on standby that are free or subsidized. And it's just a blessing every single day, like every small step, like getting that woman to this hospital and seeing them now, and seeing that baby. She delivered at 4 a.m. That means she could not have waited.
Longer. And what's been the reaction? What's been the reaction locally as the word has spread that you've taken charge of this effort?
It's been amazing. So many of the public, actually, just the public, are quite happy. I think from that tweet, I got 3,000. Like, I've never gone more than three tweets, 3,000 and beyond. I even had to learn how to use these things, because, wow. Wow. The what I've gotten from the public is just a lot of goodwill. And I pray that that goodwill continues and that someone else will uptake somewhere else, because I'm sure it's not just maternal health. There are people with strokes, with, so many issues, or even food. There are people who don't have food. There are people on the roads without a place to stay. So if everyone can do their own small part, I believe we'll all do something amazing by the end of the day. Yeah.
Well, you brought tears to my eyes, I will tell you that. I'm so incredibly moved by your efforts. And my producer's saying in my ear, she's crying as well. You've deeply touched us by your efforts. I hope you're ready for all the babies that are going to be called Jemimah. There's going to be a whole bunch of children named after you. I want to thank you personally and on behalf of the entire team and all the viewers who are watching and all saying amazing, thank you, God bless, amen. Like all these people who are saying amazing in response to what you're doing. Thank you. Thank you for the work you do. Stay safe out there. And we're proud of you. I can say that from here. We're proud of you.
Thank you so much. It means a lot. It means a lot.
Be safe, Jemimah. Thank you. Yeah, I'm just really incredibly moved by that. I hope she touched your heart as well. She's one of the heroes that's emerged in this crisis, and we'll continue to share stories like that throughout this, for as long as this lasts. We'll bring those stories to you. We try and end every show by reconnecting you with your eternal sense of hopefulness. We think that's important. We will get through this. I will say that for as long as this lasts, we will get through this. And as part of that effort, we need to keep hope alive. We need to lean into each other. We need to keep hope alive. And I know these are tough times, but we're finding different ways to make it through to the other side. And so we do this bright side segment every day, and we bring people in to share their insights and how they're coping with life under lockdown. If you've been watching, these conversations invariably end up turning towards food or my inability to cook. And for me, in terms of life under lockdown, I'm doing the show, and I thank you for joining me every day. It's probably the hardest thing I've ever done. It's a brand new medium. None of the team are here, but we're doing it every day. We're doing it, and it's my way of making it through this crisis. We have another young woman on the show today, a supermodel, Grace Mahary. She's also found her own pathway to make it through this crisis, but hers is a little bit more calming. Take a look.
Fashion model by trade, but evidently do not have a job currently in that field. So for the time being, I've actually gone to, fortunately, because I'm safe and healthy, I'm in California, I've been able to exercise my new recent trade in the wine industry as a sommelier. So every day I drag my husband, it's not really hard, to try a new wine with me at 5 p.m. And it has been quite interesting and cool to go through this process, especially given that I didn't have the, space to do it before. So I look forward to talking to you more about my nonprofit work in East Africa, in solar energy, and hopefully one day I'll be back on a catwalk or something. See you guys soon.
Wait, so Grace is having a glass of wine at 5 o'clock every day? Okay, I need to figure out how she has made that into a routine, and where I'm going wrong in life. Grace is going to join me at the top of the hour. She will be with me as my live guest over on Instagram. So please make your way over there to be part of that conversation. Grab some coffee, maybe grab a sneaky glass of wine, and join us for that chat. For right here, right now, home with Isha Sesay, that's it for today. I'll be back same time, same place tomorrow with more conversation, more insight into the coronavirus pandemic and what's happening on the continent. My producer just said in my ear, you will not be here tomorrow. No, you will be on Instagram at this time. So join me there So many platforms. I don't know what to tell you. I'm just trying to keep up. Tomorrow will be Instagram. I'll be there same time with a great conversation with an acting director who's taking the US by storm, a Nigerian. Tony Ogunbawa will be with me tomorrow on Instagram. So that's where you'll find me. But for today, here, it's a wrap. Be safe, everyone. Get that glass of wine, put some pajamas on, come hang out with me and Grace on Instagram. We'll be there from the top of the hour. Thank you for being with us. And thank you for all your support on this journey. Be safe, everyone. See you soon. Bye for now.